Come on. Let's talk about sex, baby. Let's talk about you and me.
The Adventures of Sex City is an interactive sexual health educational program. It is a game that targets late stage 5 students studying PDHPE, focusing on both sexual and alcohol related issues. As the student enters the artifact, they are immediately revealed to a rather comical style of visual imagery and flash-based graphics. This is immediately engaging them. Students are to choose a character which slowly destroys the antagonist of both games after each set of questions is correctly answered. The game is easy to use and direct and consists predominantly of true and false based questions and some multiple choice questions. This allows students to revise and improve their prior knowledge. These are divided into 2 separate subgames, which include sexual health and well-being as one, and the effects of alcohol and other drugs as another. Within the game itself, students have to complete 25 questions correctly to finish each subgame. Instant graphic feedback is created to acknowledge their result. For example, if the question is answered incorrectly, the sperminator will shoot semen at the chosen character. The correct answer will allow the chosen character to block the semen with a condom. The Adventures of Sex City create a real-life situations by engaging students more as they are able to relate the enclosed information to their own lives. However, as this is a Canadian site, the statistics do not have real-world connections to students in Australia, as the statistics learned in our curriculum are most likely to be slightly different. The digital artifact connects the 7 to 10 PDHP curriculum by addressing Content Strand 3, Individual and Community Health. The site focuses on outcomes 5.6 sexual health and drug use and 5.7 influences on health decision making and risk behaviours. The Adventures of Sex City is a very useful program to use in the classroom, along with teaching instruction. For example, a teacher can be addressing the outcome 5.6 on sexual health choices and their consequences. Once the teacher has provided the knowledge of the content, students are able to use this program to practice and revise the information learned. This could also be used as a set homework task. According to the quality teaching model, the interactive artifact incorporates key elements including significance through background knowledge, intellectual quality through deep understanding and higher order thinking, and quality learning environment through engagement and interaction. This artifact is endorsed by a health institute, which allows us to believe that the facts that are given when receiving an answer are accurate, reliable, and researched. These facts are provided regardless if the student has answered the question correctly or not, making sure students are revising and refreshing all areas of the topic. After completing the game, there is an option to download the questions and answers. This again will help with revision. There are links provided to additional information on both sexual health and drugs and alcohol, and contact information to various health clinics, which may have a positive reaction to students who may need further help but are too intimidated to ask. The main strengths for this artifact are that it's highly interactive for students as they have to use their prior knowledge, and provides a light-hearted revision task for an arguably confronting subject. However, there are also some weaknesses, including the graphics can be seen as inappropriate and possibly offensive, and there is no level-based activities, therefore the students have to complete 25 questions before finishing the game. This can become repetitive and unmotivating, and there are no rewards or sense of achievement after concluding the sub-games. Overall, The Adventures of Sex City is an excellent artifact to teach sexual health and other drugs in a fun and interactive way to Stage 5 students.
Let's talk about sex, baby.